As we battle the second wave of the pandemic, we continue to applaud our health workers, but most of them are now fatigued, overburdened, and overstressed. Our health workers are demanding for the real recognition of their value through just compensation, social protections, and inclusion in decision-making in the COVID-19 crisis response. Within our health workforce is a silent workforce that continues to face the daily risks of caring for our patients and saving lives. They are the migrant health workers, and the majority of them are women. The World Health Organization estimates that 1 out of 8 nurses in the 86 countries they have surveyed are migrant workers. Many of them come from developing countries that equally need them. But because of the difficult situation these workers are living in, the low pay, the lack of facilities, lack of social protections, these workers are forced to leave their homelands to find work elsewhere. The migration of health workers from poorer countries in the south to the richer countries of the north has exacerbated the global inequalities in health. Even before the pandemic, the World Health Organization has already warned that the world is short of 18 million health workers. Migrant health workers are an essential part of our workforce at the front lines. They save lives, but sadly, many of them have also paid for their lives. This is unacceptable, and this can be avoided. In the US, almost half of the nurse deaths due to COVID-19 are nurses of color or of immigrant backgrounds. A third of these deaths are Filipino nurses. In the UK, it has been found that COVID-19 infections in the nursing workforce was highest among Asian ethnic groups, and that the risk of dying from the virus was higher in Black, Asian, and minority ethnic communities. On International Migrants Day, we honor all the migrant health workers who are helping us fight this pandemic, and we honor them by giving them power. P. Public investment. We need to invest in quality public health services so that our health workers are not forced to leave their jobs due to poor pay and dire working conditions. O. Organizing. The right to organize and to join trade unions must be guaranteed for all migrant workers, as stipulated in the Migrant Workers' Conventions of the United Nations and the International Labour Organization. W. Women. Women are the majority of our healthcare workers. Integrating the gender dimension into migration policies is critical to empowering women migrant workers. This includes reorganizing the nature of care work and integrating care into public policy and public services. E. Equal rights. Equal rights to decent work, fair and ethical recruitment, and social protection for all migrant workers. R. Responsibility. Sharing the global responsibility in the rights-based governance of labor migration founded on the principles of solidarity, justice, and protection of human rights for all. Power to all migrant healthcare workers.